video conferencing at Intermountain Healthcare is paving the future in healthcare. We've heard of this tool used for routine doctor's appointments, but what about for the most intense and catastrophic diseases? TeleHealth infectious disease program launched 2 weeks ago, and this week another community hospital came online.
So you were saying you had this HIV patient come in?
Right, I have a 33-year-old woman who I suspect has advanced HIV disease.
Dr. Linda Venner needs advice for treating a patient in Altaview Hospital in Sandy. So she's called up infectious disease specialist Dr. Eddie Stenehjem at Intermountain Medical Center in Murray.
Is there anything I would need to treat for empirically before we got the lumbar puncture?
In terms of empiric therapy, unless she's showing signs of meningitis or severe meningismus, I'd probably wait until we see what the test results are.
Okay, sounds good.
Doctor-to-doctor communication is important for overall patient care, but just imagine when an expert such as Dr. Stenehjem can speak directly to the patient without having the patient leave their hospital.
I'll actually go into the patient room virtually, talk to the patient, interview the patient, and make recommendations to the clinician and the treating team at the local facility. This many times enables the patient to stay in their community and not have to be transferred to a larger medical center.
Smaller hospitals often don't have the luxury of an in-house infectious disease specialist like Dr. Stenehjem, but now these community hospitals can tap into that knowledge virtually.
You're able to administer possibly the medicine that person needs while the specialist here at Intermountain Medical Center is watching.
Correct, and they can participate in interviewing the patient with us. They can be in the room on the telemonitor going through a physical exam with me. It just really expands our ability to communicate.
Dr. Stenehjem says trained infectious disease experts improve patient outcomes, especially if it's done in a timely manner. Intermountain Healthcare has a network of 16 community hospitals spanning across Utah and southern Idaho. By the beginning of next year, they'll all have access to Stenehjem's knowledge.
We know that in the U.S., 72% of hospitals have less than 200 beds, and the majority of them don't have ID clinicians or practitioners. And so we know this is a model that may be able to be used nationally to really bring stewardship and bring ID consultation to those smaller hospitals that otherwise wouldn't have had it.
And for more information about IMC's telehealth program, go to our website at goodforutah.com.